Did you know that low blood sugar isn't the only issue diabetics face? It's unstable minerals that silently make blood sugar harder to control. Studies show that most people with diabetes are missing key minerals that their body needs to regulate insulin, support the pancreas, and move glucose into the cells. And the older you get, the more your body loses these minerals through urine, especially if you're on certain medications. Here's what's even more surprising. Missing just one of these minerals can raise your blood sugar, slow metabolism, and make you feel tired no matter how healthy your diet is. But when you restore them, even through food or supplements, your energy, focus, and glucose control can improve in just weeks. In this video, we'll reveal the top 3 minerals every diabetic must take to help lower blood sugar naturally. These aren't rare supplements or expensive treatments. They're simple, science-backed nutrients that most people overlook. Wait until you hear about the second one. It's known to make insulin up to 50% more effective. Before we get started, answer these 2 quick questions. Do you currently take any mineral supplements? And what's your biggest struggle with managing blood sugar? Cravings, fatigue, or fluctuating readings? Share your answers in the comments. We'll be giving tips that fit each situation. Now, let's begin with number 1. Number 1, magnesium. Magnesium is one of those minerals most people don't think about until it starts running low. And for diabetics, that happens more often than you'd expect. Every time blood sugar rises, the kidneys work harder to remove the excess. But in doing so, they also flush out large amounts of magnesium. Over time, this constant loss leaves the body depleted, making it much harder to keep blood sugar levels steady. Here's where the problem gets worse. Low magnesium makes the body more resistant to insulin. That means blood sugar stays high, which then leads to even more magnesium loss. It's a harmful cycle that many people don't even know they're trapped in. The tricky part is that magnesium deficiency looks a lot like common everyday issues, so it's easy to miss. Muscle cramps and twitching, especially in the legs and feet, are typical because magnesium helps muscles relax. Constant tiredness, even after getting a full night's sleep, is another sign. Magnesium plays a key role in producing ATP, the main energy source for your cells. Nerve problems such as tingling, numbness, or burning sensations often worsen when magnesium is low. If you've been feeling anxious or having trouble sleeping, a lack of magnesium could be the reason. It helps calm the nervous system, so when levels drop, stress hormones rise. Even irregular heartbeats or palpitations can signal low magnesium, since this mineral supports healthy heart muscle contractions. A deficiency in magnesium doesn't just cause uncomfortable symptoms, it can damage several systems in the body. Fertility often declines in both men and women. In men, low magnesium can reduce testosterone and weaken sperm, making conception more difficult. In women, it can disrupt menstrual cycles and raise pregnancy-related risks. Libido can also drop because magnesium regulates hormones and blood flow. The nervous system suffers too. Without enough magnesium, nerve pain worsens, sensitivity increases, and the body's ability to repair nerves slows down. The kidneys are affected as well, since magnesium helps prevent calcium buildup. Low levels make kidney stones more likely. Eye health can decline because magnesium keeps blood vessels flexible. When levels are low, oxidative stress increases, raising the risk of diabetic retinopathy. The heart and blood vessels are often the hardest hit. Magnesium keeps blood pressure stable, prevents artery stiffness, and lowers inflammation. Without it, blood vessels tighten, blood pressure rises, and the risk of heart attacks and strokes increases sharply. On a cellular level, magnesium helps insulin work properly. It activates insulin receptors, allowing glucose to move into your cells. When magnesium levels drop, cells stop responding to insulin as they should. Magnesium is also essential for making ATP, the energy your body runs on, so when it's low, fatigue quickly follows. It also balances calcium inside cells, but without enough magnesium, calcium builds up where it shouldn't, causing stiffness, inflammation, and oxidative damage. The good news is that magnesium deficiency can be fixed through food. Pumpkin seeds are one of the best sources. Just 1 ounce, 28 grams, gives about 40% of your daily needs. Cooked spinach is another great option, providing roughly 38% per cup. Almonds are an easy snack, offering around 27% per ounce. Dark chocolate isn't just a treat. 1 ounce provides about 24% of your daily magnesium. Avocados are another simple choice, giving around 15% of your daily requirement per medium fruit. These foods don't just raise magnesium levels, they also help control blood sugar and improve overall health. If you enjoy more gourmet meals, there are delicious high magnesium dishes worth trying. A Japanese miso-glazed salmon with sesame spinach can give you over 60% of your daily magnesium while supplying omega-3s for heart health. A French almond-crusted halibut with sautéed Swiss chard provides about 50% of your daily magnesium and supports insulin function. And for something sweet, a black truffle and dark chocolate mousse can deliver over 40% of your magnesium needs while satisfying dessert cravings. If food alone isn't enough, supplements can help, but not all forms are absorbed well. Magnesium glycinate is one of the most effective options because it's easy on the stomach and absorbs efficiently. Thorne magnesium bisglycinate provides 200 milligrams per capsule and works well for muscle relaxation and nerve health. Another good choice is Doctor's Best High Absorption Magnesium, which also provides 200 milligrams per tablet in a chelated form that the body can use better. These options are far superior to magnesium oxide, which absorbs poorly and can cause digestive discomfort. However, it's also important to avoid foods and habits that deplete magnesium. White bread, pasta, and processed grains are stripped of magnesium and add no value. Excess sugar forces the kidneys to excrete more magnesium due to insulin spikes. Caffeine, especially from energy drinks and sodas, blocks magnesium absorption. Alcohol is another major issue because it drains magnesium and interferes with how your body uses it. Even too much calcium, particularly from supplements, competes with magnesium for absorption, worsening deficiency. So if you've been feeling constantly tired, struggling with muscle cramps, noticing more nerve pain, or dealing with erratic blood sugar, correcting a magnesium deficiency might be the missing link your body needs. Number 2, zinc. Zinc is one of those minerals most people overlook, but for people with diabetes, it can make a huge difference. The problem is that diabetes causes your body to lose zinc much faster than normal. High blood sugar leads to frequent urination, and with every trip to the bathroom, more zinc gets flushed out of your system. Your pancreas relies on zinc to release insulin properly. Without enough of it, insulin becomes less effective, making blood sugar much harder to control. Chronic inflammation, which is common in diabetics, also depletes zinc because your body uses more of it to repair oxidative damage. On top of that, certain medications like diuretics and ACE inhibitors can lower zinc levels even further, making deficiency more likely. The tricky thing about zinc deficiency is that it doesn't always show obvious symptoms. One of the most common warning signs is slow wound healing. If small cuts take too long to close, low zinc could be to blame. Getting sick often is another sign. Zinc is vital for immune strength, so if you catch colds easily, your body may be running low. Intense sugar cravings can also point to a zinc deficiency, since this mineral helps regulate both insulin and appetite. Skin issues such as dryness, acne, or stubborn rashes may also indicate a lack of zinc because it supports collagen production and skin repair. Other clues include a reduced sense of taste or smell, white spots on your nails, and even thinning hair. Zinc plays a role in almost every major function of the body, so when levels drop, multiple systems start to suffer. Fertility is one of them. Zinc is needed for hormone balance. In men, low levels cause reduced testosterone, poor sperm quality, and sluggish sperm movement, which makes conception harder. In women, zinc deficiency can cause irregular periods and hormonal imbalances that interfere with fertility. Low zinc can also lead to a reduced libido in both men and women, since it's directly tied to testosterone, which drives sexual energy and desire. The nervous system suffers as well. Zinc protects nerve cells, and without it, diabetic neuropathy can worsen, bringing more tingling, burning, and nerve pain. The kidneys are also affected because zinc helps control inflammation. When zinc levels are low, the risk of kidney damage or disease rises. Vision can decline too, since zinc is essential for maintaining healthy retinas. Deficiency can make diabetic retinopathy more severe and increase the risk of vision loss. Zinc also protects the heart and blood vessels. It helps keep inflammation low, supports flexible arteries, and regulates cholesterol. Without it, the risks of high blood pressure, heart disease, and stroke increase significantly. At the cellular level, zinc is critical for insulin activity. It helps insulin attach to receptors so glucose can enter the cells and be used for energy. When zinc is lacking, insulin becomes less efficient, causing higher blood sugar and worsening insulin resistance. The pancreas also depends on zinc to store and release insulin. A deficiency slows this process, making blood sugar control more difficult. Beyond that, zinc acts as a strong antioxidant that helps fight inflammation and oxidative stress. Without enough of it, cells get damaged faster, age more quickly, and work less efficiently, all of which make diabetes complications worse. The best way to increase zinc levels is through food. Oysters are by far the richest source. Just 3 medium oysters provide over 200% of your daily zinc requirement. Beef liver is another great choice, with 100 grams offering around 80% of your daily needs. For plant-based eaters, pumpkin seeds are an excellent option. Just 1 ounce, 28 grams, gives you about half your daily zinc requirement. Grass-fed beef provides about 40% per 100 grams, while a cup of cooked chickpeas delivers around 25%, making them a good option for vegetarians. If you like gourmet food, there are plenty of delicious ways to increase your zinc intake. Japanese oyster sashimi with ponzu sauce, 100 grams, provides more than double your daily zinc needs. French beef tartare with a quail egg yolk, 150 grams, gives you about 90% and also supplies a large dose of easily absorbed iron. For a Mediterranean twist, grilled lamb chops with a toasted pumpkin seed crust, 180 grams lamb, 1/4 cup pumpkin seeds, can deliver about 80% of your daily zinc along with minerals that support insulin and hormone function. If you struggle to get enough zinc from food, supplements can help. The most effective and easily absorbed forms are zinc picolinate and zinc bisglycinate. Thorne Research zinc picolinate, 30 milligrams per capsule, is a reliable choice that's gentle on digestion. Another good option is Now Food zinc glycinate, 30 milligrams per tablet, which is chelated for better absorption. Most diabetics do well with 15 to 30 milligrams per day, but it's important to balance zinc intake with copper since they compete for absorption. Some habits and foods can also make zinc deficiency worse. High sugar diets are a major cause because they raise insulin demand and increase zinc loss through urine. Whole grains and legumes contain phytates that block zinc absorption, but soaking or sprouting them can help. Too much calcium, especially from dairy or supplements, can also interfere with zinc uptake. Alcohol is another major problem because it depletes zinc and raises inflammation, which makes insulin resistance worse. Junk food is just as harmful since processed foods lack nutrients and trigger inflammation, draining zinc even more. Zinc may be one of the most overlooked minerals for people with diabetes, but it's essential. Without it, insulin weakens, blood sugar becomes harder to manage, and complications develop faster. Increasing your zinc intake through food or supplements can improve insulin sensitivity, protect your nerves, support heart health, and enhance fertility and libido. It also helps wounds heal faster, reduces sugar cravings, and strengthens immunity. Number 3, chromium. Chromium is one of those minerals that rarely gets mentioned, yet if you have diabetes, it's far more important than you might think. Your body naturally loses chromium through urine, and the higher your blood sugar, the harder your kidneys work to remove it, taking even more chromium with it. Just like magnesium, this becomes a serious issue because chromium helps insulin move sugar into your cells. When chromium levels drop, insulin can't do its job properly. What makes things worse is that stress, processed carbs, and frequent urination deplete chromium even faster. Since your body doesn't store much of it, you have to get enough through food or supplements. The difficult part is that low chromium often looks like regular diabetes symptoms, so most people never realize they're deficient. If your blood sugar has suddenly become harder to manage, even though you haven't changed your routine, a chromium shortage could be the reason. Chromium helps control insulin and appetite, so when levels fall, your body struggles with sugar cravings and hunger control. Feeling drained, mentally foggy, or sluggish, that's another sign. Some people even experience mood changes or anxiety because chromium supports healthy brain function. If the deficiency worsens, you may start to feel tingling or burning sensations in your hands and feet. Low chromium doesn't just affect blood sugar. In men, it can reduce testosterone and lower sperm quality, making it harder to conceive. In women, it can disrupt hormonal balance and cause irregular menstrual cycles, making pregnancy more difficult. Since chromium is also needed for healthy circulation and energy, low levels can even lower sex drive. Your nerves can suffer too. Without enough chromium, blood sugar levels fluctuate more severely, putting extra stress on your nervous system and raising the risk of nerve damage. The kidneys also take a hit. Chromium helps protect them from oxidative stress, and without it, kidney damage from high blood sugar develops more quickly. Vision problems can also appear. Low chromium has been linked to worsening diabetic retinopathy. And your heart isn't spared either. Chromium helps regulate cholesterol and fat metabolism. When levels drop, LDL, bad cholesterol, rises, arteries stiffen, and the risk of heart disease increases. On a cellular level, chromium acts as insulin's helper. It's part of what's known as the glucose tolerance factor, which allows insulin to move sugar into your cells more effectively. When chromium levels are low, insulin becomes weaker, leaving more sugar in your bloodstream and forcing your pancreas to produce extra insulin. Over time, that leads to worsening insulin resistance. Chromium also supports the breakdown of carbs and fats, so when it's missing, your body struggles to use glucose for energy, making you feel tired and more prone to weight gain. The good news is that you can naturally boost chromium by eating the right foods. Broccoli is one of the best sources. Just half a cup gives you about 50% of your daily needs. Grape juice also contains a good amount, with 1 cup offering around 40%, though diabetics should keep portions small because of the sugar content. Brazil nuts are another excellent choice. 1 nut provides about 30% of your daily chromium. Lean beef gives you roughly 25% in a 3-ounce serving, and eggs add another 10 to 15% per large egg. If you enjoy gourmet meals, certain dishes can give your chromium levels a healthy boost. A Japanese Wagyu steak served with sautéed broccoli and Brazil nut pesto can supply over 75% of your daily chromium needs, along with healthy fats and protein to keep blood sugar stable. A Mediterranean-style grilled lamb chop with rosemary-infused grape reduction and steamed asparagus provides around 60% of your daily chromium intake while supporting heart health. If you prefer something richer, a French-style duck liver pâté with poached eggs and truffle roasted mushrooms delivers close to 50% of your daily chromium needs and supports healthy insulin function. If diet alone isn't enough, supplements can help. The most effective forms are chromium picolinate and chromium polynicotinate, as they absorb well and enhance insulin sensitivity. A great option is Now Foods Chromium Picolinate, which contains 200 micrograms per capsule, enough to support blood sugar without going overboard. Another solid choice is Thorne Research Chromium Picolinate, which offers 500 micrograms per capsule for those with more severe deficiencies. Because the body needs only small amounts of chromium, start with 200 to 500 micrograms per day and monitor your blood sugar response. Certain foods and habits can lower chromium levels faster, so avoiding them is just as important. Diets high in refined sugar and processed carbs are the biggest culprits. They increase insulin demand and lead to more chromium loss through urine. Excess dairy can also interfere with absorption because calcium competes with chromium in the body. Processed foods like white bread, pastries, and sugary drinks not only deplete chromium, but also make insulin resistance worse. Alcohol is another issue. It speeds up chromium loss and makes it harder for your body to maintain stable levels. Chromium might not be the first thing you think about when managing diabetes, but it plays a major role in keeping blood sugar balanced, improving insulin sensitivity, and supporting metabolism. If your sugar cravings are intense, your blood sugar feels out of control, or your energy has been low, raising your chromium intake could make a noticeable difference. If you found this video helpful, make sure to hit the like button and leave a comment below. Tell me which of these minerals you think your body needs more of. And if you're serious about improving your health, don't forget to subscribe. More helpful tips on diabetes management are coming soon. Thanks for watching, and I'll see you in the next one. Take care and stay healthy.